Good afternoon and welcome. Thanks for joining us for our Recognizing and Navigating Perinatal Depression panel. This is hosted by Tallahassee Memorial Healthcare, and we thank you guys for joining us this year for our virtual series with the Baby and Family Fair. We look forward to answering your questions and discussing this often neglected but very important topic. So I'm Amy Kimmel, and today I'll be your moderator. I'm a mom, a doula, a childbirth educator, and I've been volunteering nationally with Postpartum Support International and locally with Postpartum Wellness Tallahassee. So I'm very excited to talk with this great panel of women. So let me introduce our panel today. First, we have Dr. Gregorie Elie, and she is a family medicine physician on faculty at the TMH Family Medicine Residency program. Dr. Elie provides both obstetric care and primary care to a wide spectrum of women in our community and teaches physicians to do the same thing. We're also joined by licensed clinical social worker, Heather Lincicome. Heather serves as administrator over TMH's Behavioral Health Center and as chief liaison officer at the Apalachee Center. She has a passion for maternal mental health and specifically helping moms navigate perinatal depression. And lastly, join me in welcoming certified nurse midwife KK McKeon to the panel. KK works at TMH's Anderson-Brickler Midwifery, caring for moms before, during, and after pregnancy. You can also find her up in TMH's labor and delivery triage and delivering babies in the Women's Pavilion. KK has a passion for helping moms navigate perinatal depression, and she's also an active member in Postpartum Wellness Tallahassee. So thank you all so much for joining us today, Dr. Elie, Heather, and KK. So today we will be unpacking perinatal depression, what it is, what can cause it, and what to do about it. We'll also be answering your top questions. Some of those questions were submitted ahead of time, and I'll be handing those out to each of our panelists. And then if you have questions that come up as you're viewing, you can send those using the Q&A feature here in Zoom, and those will get to us for our Q&A session at the end. We'll be sharing them with our experts. So without further ado, let's jump into these questions. So Dr. Elie, will you tell us, many moms are familiar with the term postpartum depression, but not many understand or have heard perinatal. Can you explain kind of what that is?
Yeah, sure. So the term perinatal actually encompasses a larger period of time compared to just postpartum. So we're talking the entirety of the pregnancy and including the postpartum period as well, which is an important distinction because while I think postpartum depression is gaining more awareness, which is great, we often neglect the similar diagnosis during the actual pregnancy. So it's important to think of perinatal or peripartum depression as something that can happen during pregnancy as well as the postpartum period.
Mm-hmm. What time frame is considered to be perinatal mental illness? If you're, for example, experiencing symptoms as a mother of an 18-month-old, would that be considered postpartum depression?
Right, that's a great question too. So when you look at the American Psychiatric Association, they actually, the diagnosis for postpartum depression is similar to that of a major depressive disorder. The criteria are identical, except with the caveat that it happens in the peripartum period. And so some people think that's usually towards the end of the pregnancy and then up to 12 months after, but really the entirety of the pregnancy, the peripartum period and postpartum is when that can start. Now, that's just when it starts, right? So those symptoms can persist for years after the initial diagnosis and would still be considered perinatal depression because it was diagnosed in that time period.
Yeah, I know we just wrapped up the infertility and awareness month last month, or we're wrapping it up now. Have you seen that to be a time period where people can develop a perinatal mood disorder or depression?
Yes, definitely. So you're still having, and we'll talk about this a little bit later, but you're still having those hormonal changes. And when you incorporate that into a stressful time period, especially women who are struggling with becoming pregnant or who are suffering recurrent miscarriages or any miscarriages at all, that trauma and that stress certainly predisposes those women to peripartum depression. Absolutely.
All right, this next question I'm going to hand to KK. We hear a lot about baby blues. How do you distinguish those normal mood shifts of pregnancy and postpartum from a mental illness?
The blues are very common. And the big distinction is the timing. Postpartum blues happen 3 to 5 days after delivery. It's usually when the mom's at home. And it can last 2 to maybe 3 weeks. And then it kind of dissolves itself. It doesn't continue. So that's the big thing. But the true postpartum depression, usually we see a little farther postpartum. Sometimes it's even after we see the moms at their normal 6 to 8 week checkup. Mm-hmm. So that's important, that even if you don't take your issues to us, you can use your primary care provider.
Mm-hmm. Absolutely. So for Heather, perinatal mental illness isn't just limited to perinatal depression. So can you tell us what other perinatal mental health disorders there are, and maybe a little of the symptoms about each?
Sure. I don't think there's any immunity to an array of mental health disorders perinatally. I think the majority that we see obviously is depression and anxiety. Those are the two that we see most pervasively. But we also see a lot of the budding, if not existing, bipolar disorders. Sometimes women are aware of their family histories regarding that. Sometimes they're not. So, sometimes organically, the onset of something like a bipolar disorder can coincide with kind of early childbearing years. We used to bipolar used to be referred to as manic depression. So sometimes what we see with women with that is, they may come in crisis. You may see periods of what looks like mania or psychosis. And really those are just the highs and lows of an existing bipolar disorder. I think those are probably the three top that we see. There's also women that don't come into pregnancy, kind of expecting things. We deal with mothers that have, had sexual assaults or have had past trauma. So PTSD can often be something that's they're struggling with as well. Some of the obsessive compulsive disorders can also kind of bud during this time. As Dr. Elie and KK mentioned, it's a stressful, changing time. And so those are probably the most common we see. There's going to be periods naturally during pregnancy of irritability, highs and lows, and some of those are they're just natural part of hormone fluctuations and changing in the body. But I think ultimately what you want to look at with symptoms is your overall functioning. Are you sad more days than not? Are you not sleeping? Are you sleeping more than usual? Are you having extreme fluctuations of mood that you can't control? Often women that are struggling with these things, there's obviously a higher propensity for suicidal ideations. So those are obviously signs that women need to look at. And definitely I'd say during this time, family needs to be educated too about what to look for.
Yeah. How would you suggest that a mom go about preparing for her and her family to get educated about this? Because that's something that I've run into a lot, where moms are telling me what their symptoms are, and their families are telling them, oh, that's just normal. And then they kind of run into this lack of support, and some of that's from education. What resources could you point those family members to?
I'm always a big encourager. We're inviting families to visits, if you can go, inviting partners to visits with your practitioner. There's nothing better than the Dr. Elie and KKs of our world that can, really kind of help heighten the importance of these things. I think families listen to those things. I think inviting them to support groups, if you have the ability to do that. There are tons of resources, tons of reputable organizations that have research-based material, that this is not just something that is sometimes a fleeting thing. This is these are very serious issues that women undergo that require a lot of significant support. So I think utilizing, the practitioners that you have in your area, the support groups that you've developed, which is phenomenal. As much involvement as you can get families in to really help see that this is not just an isolated thing, and it's something that's really important for women to be able to talk about openly without fear and stigma.
Yeah, you hit the nail on the head with that. Being able to talk about it openly. Hopefully we're creating that a little bit today. So,
maybe if I might, what I was going to add to that, which is kind of piggyback off of what Heather said, is being able to talk to your provider about the symptoms that you're having is really important. Actually, I think it's about half of women with a major depressive episode are actually have these episodes before they deliver. And then even more than that go undiagnosed. And I think part of that is there seems to be a barrier of communication between the patient and their provider about talking about them because of maybe taboo information or just not being aware. And so just being able to talk to your provider and asking those questions is really important, because that diagnosis may be there and we just wouldn't know about it unless it was discussed. Yeah. And obviously us as providers should be asking those questions as well, but yeah.
Yeah, and to add to what you said, my own experience with postpartum depression started, my oldest is almost 10 now. So it started years ago where I've seen the shift in providers, and I've seen how much more they're bringing up emotional and mental well-being during prenatal visits, during the birthing process, during your postpartum checkup, and the screening is a small thing. It's a lot of times it's those conversations when they just see you when you walk in and say, oh, how are you really? Mm-hmm. That seems to make a big difference. And I've seen that shift. And my encouragement, just from my own experience, having been a very late diagnosed case, was to really be honest with myself, would have pushed me to ask for help sooner. And so when, Heather, you're talking about all those symptoms, I saw a lot of those in myself, but gave them all excuses. And so I think if I had written them down and seen how frequently they were happening, then it would have been harder for that to be kind of explained away. So that's just one tip I'll share to the viewers, is write them down, look at it on a calendar. And like you're saying, more bad days than good. You start to look at how frequently these things are occurring. It makes you realize the need for help. So KK, talking about how frequently people suffer in silence and don't ask for help, a lot of that goes to them feeling very alone. But you and I both know how common this is. Tell us a little bit about how prevalent postpartum depression and perinatal mental illness is.
It's a lot more prevalent than most people realize. The American Psychological Association listed as 1 in 7 women will have perinatal mental illness along the whole range. So it's as common as gestational diabetes, and we screen for that. We take care of that. We manage it, and that's what we want women to know we can do with their depression or their mental illness. It's something that can be managed and treated. It's not your fault, and we'll get better.
Yeah, I definitely appreciate that. It's not your fault, because that was a message that I carried with me. I'm not sure where I picked it up, but I carried it for a while, that I should just be able to get better. So Dr. Elie, what is it about pregnancy that changes mood, that triggers this change?
Yeah. A lot of things. One of the biggest things that, comes to mind initially is those hormonal changes, right? So we immediately think of estrogen and progesterone. Those have pretty drastic changes throughout pregnancy. You kind of start at a low range, it slowly rises throughout pregnancy, and then there's a steep drop off after delivery. Some other hormones like cortisol, your thyroid hormone, oxytocin, melatonin, which helps us to sleep. All of those things are constantly kind of changing throughout pregnancy, and some people can tolerate those changes. Some people, with that as a baseline plus added stresses of preparing for baby to come, financial stresses, partner support, changes in work, maybe not being able to exercise like you used to, all those things together, I think set up a perfect storm for peripartum depression to occur. I mean, there's a lot, all those hormones that I listed kind of help your body do what it's supposed to do at baseline and respond to stressful stimuli at baseline. So when you're talking about changes in all of those things, it can be difficult to respond normally and for your body to respond normally.
Mm-hmm. So some of the changes that you mentioned of added stressors made me think of this question. I'm jumping out of order, but the pandemic has added an extra layer of stress for many, many families, both in workload, financial stress, and potentially partner support, because you may be all home together a lot, and the stress there and tension can kind of rise. Right. So what have you seen in regard to perinatal mental health during the pandemic? Has that affected the rates that you guys are seeing? Anyone can jump in on that one.
I've seen overall across the board increased mental health issues, more diagnoses of depression and anxiety across the board. So that certainly includes our moms as well. I think it seems that a lot of that, of course, there are many reasons, but I think that the isolation, the social isolation is a big factor in that, and not being able to interact with people that you usually interacted with to bring you that support and joy and stability that you once had. That's kind of just been stripped away from many people. And so they're forced to kind of go through the pregnancy kind of isolated, not necessarily on their own if they have their partner with them, but potentially. So that social isolation is a big key, I think, to why a lot of people have been experiencing more depression, more anxiety, more mental health issues.
Absolutely. Yeah. Heather, can I get your thoughts on that too?
Yeah, we definitely seen an influx in inpatient care, but definitely more of an influx in utilization of our emergency room for mental health crises. I think for a while it was very apparent that people were, delaying care because of fear, which is, is understandable. We were all in this boat together trying to kind of wade through the facts as they changed every day. So we saw quite a bit of that. And I think before telemedicine really kind of, we kind of got broadcast that we still had that available and we were encouraging people to continue care. People were really just struggling to kind of maintain the day-to-day. I think for a lot of mothers, that's very real because, we had more mothers staying at home, managing other children who were doing digital academy from home. I mean, if you're thinking about managing that and a pregnancy and, all of the things that they still have to do, that's quite significant. That is quite a load on anyone. So, we saw a lot of that. I mean, when you're thinking about survival on a daily basis, sometimes your mental health takes the back burner, unfortunately. And so, I'm hoping that we're rounding the corner with that. And women are really seeing that we're still here, we're still very much providing care, and that, as KK mentioned, that you have to take care of your mental health just like anything else. So it all ties in together. So
Heather, what are some of the risk factors that are associated with a perinatal depression or mood disorder in the perinatal period? Is there a rhyme or reason to who's impacted?
I certainly think there's risk factors. I think Dr. Elie touched on a lot of those. I mean, you know, pregnancy is a time where you need the utmost support, and we know that not all women have, you know, the kind of support that they need. So certainly there's risk factors when you lack that support. Certainly the pandemic has caused a lot of financial stress for a lot of families. That's definitely risk factors. So housing, you know, food insecurities, all of those are very real issues for a lot of members of our community, and continue to be. But there's a significant number of women that will be at risk just because of genetics. So family histories, especially of bipolar disorders, you know, they run a higher risk for developing bipolar disorder, some type of mood disorder as well. And as I referenced, sometimes the onset of these disorders happens to be very early 20s, which is, you know, those early childbearing years. So I can't tell you how many women we've worked with that are really, really scared because all of a sudden there's sort of this budding mood disorder that, you know, that would have been present even if they had not been in pregnancy, but now it just coincides with a, you know, significant changes with the body and a birth. And so, you know, all of those things I think are definitely, like I said, go into the risk factors. You know, we're talking about treatment, and I know we're going to get into a little bit more of that, but it's really very significant that we talk about what happens when women don't seek treatment. And so I encourage that one of the biggest risk factors was when you delay getting care, even when you think that there's some budding symptoms or you start to worry, that women do not have to struggle in silence on their own.
Yeah.
Another important risk factor is women who've had complicated pregnancies. Things haven't gone smoothly. They've had to go to MFM to follow maternal fetal medicine to follow for, you know, whatever insert high risk diagnosis, and or their delivery wasn't smooth. They ended up in an emergency C-section. They tore. They had to have a vacuum used. The baby's heart rate was dropping. There were lots of people in the room. The baby had to stay in the NICU. I mean, all those things are traumatic experiences during the pregnancy and postpartum that definitely put women at higher risk for postpartum depression.
So what if there's a mom that doesn't have those risk factors? I know I was in the case with my first, where I thought I didn't have a traumatic birth. I had a beautiful, lovely birth. And yet I found myself struggling. You know, the moms who don't have risk factors, what's their risk?
It can just happen. It can happen.
Yeah.
You just have to, again, not blame yourself, maybe not always look for the cause, but just seek help and get taken care of.
Yeah.
Mm-hmm.
And that's why awareness is so important, because there are women who have support, they have the financial means, their pregnancy went smoothly, their delivery went smoothly, everything's fine, and yet they find themselves struggling with these things. So I mean, it can literally happen to anyone.
Yeah, that's why I said none of us are immune to it. I mean, it does happen. It's just important to really be aware of, you know, be aware of the signs and symptoms and be able to openly discuss, especially with your provider that you're seeing the majority of the time during your pregnancy, and your support, how you're feeling and what's happening.
Yeah.
So you can catch it earlier rather than later.
Yeah. So I know we're all dying to get to it. The most important question of all is, you know, mom's noticing this, she's talking to her care provider, then, you know, what are the treatments? How does she cope? Heather, maybe you can start us off with that.
I am a big fan, obviously, as a therapist, of psychotherapy. Big fan. Because I do think that for the majority of women, especially when we talk about mental illness being on a spectrum or mental health being on a spectrum, will really benefit, you know, most women. But I think that absolutely needs to be in conjunction with their the rest of their providers. So I am a big fan of having very collaborative, very involved providers. There are Lots of treatment options that are safe. I will certainly defer to Dr. Elie on that part of it. But I will say that it's very important for women who do know that they have a family history or are aware that they have a mental illness, even at the early onset of pregnancy, to really talk to their provider about those things, make them aware, because I'm not an advocate of stopping medications or starting them without your provider being involved in that. So I think there are a ton of things that work, and sometimes it collaboratively takes both therapy and medication. Sometimes it's one or the other. It's really not a one size fits all for any woman. Everybody is different. But my advisement is to always seek help with the professionals that you're meeting with, to really discuss and get their involvement in that.
Yeah,
Absolutely.
Absolutely. I think psychotherapy is great, especially if you're able to take part in it. I mean, especially for those women who may have milder symptoms, and it's they don't necessarily want to start medication yet, or they're worried about it for whatever reason. Psychotherapy is great, and I think psychotherapy is great in conjunction with medication, like Heather mentioned. A lot of women are concerned about breastfeeding while on medications, or even during pregnancy, taking some of these medications. And what I always tell my patients is the benefit of taking the medications, being able to take care of your child, being able to do your day-to-day functions, eat, clean, whatever you need to do, that benefit outweighs any potential risks of the medications to the baby. And a lot of the commonly used antidepressants and even antipsychotic medications have been thoroughly studied and have been proven to be safe for breastfeeding and during pregnancy. But certainly, talking with your provider, that's something that they can certainly look into and make sure that those things are safe for you to be on. The last thing I will ever do is stop a woman who's on a medication and she's stable and she's doing well, stop that medication because she's pregnant. That's asking for trouble.
KK, do you have any additional recommendations?
Yes.
I know you've got experience in this.
Yes, as Dr. Elie mentioned, there's many antidepressants and different varieties of antipsychotics, sleeping medicines that you may have to go by trial and error. Someone may be perfectly responding well to Zoloft, and some women it makes their symptoms worse. So another thing is to give yourself time, about 2 weeks, to see the effects of the medicine. Unless you're having some terrible side effects, then we can stop them. And one other thing about medicines, never stop them cold turkey. If a mom wants to get off of them, or say she's been on them for a year and she's doing well, I always do a slow taper. You don't want to stop them cold turkey.
Yeah, absolutely. Let's see. So you guys have already talked a little bit about taking medications during pregnancy. Do you have anything else to add on that? I don't want to totally skip it, but we kind of covered it when we talked about treatment.
Yeah.
Now, this one I feel like is a good one for KK, because I know she and I talked about it for my own care with my third baby. But what about moms who have experienced a perinatal mental illness before and are planning and taking care of their current pregnancy? What advice do you have for them?
Well, if she's on medicine, stay on it. And in fact, something that happens during pregnancy is your kidneys go into overdrive. As most pregnant women know, they're urinating every hour or so. That can excrete the drugs quicker. So you might have to actually go up on your medicine while you're pregnant. And again, after the baby comes, you might have to go back down on it. So, and if you're not on medicine, if you're doing well during the pregnancy, you're not guaranteed to have postpartum depression with the next baby. But being aware of the signs and symptoms. And if you see them, just knowing that the quicker you get into treatment, the better you will feel, or the sooner you will feel. If it gets untreated, it's going to get worse. It won't just go away.
Yeah. I know Heather seemed to have some ideas about the risks or what can kind of go wrong when mental illness is not treated. Heather, did you want to add some ideas there?
Well, I mean, you know, the last thing that a pregnant mother wants to do is be hospitalized, period, but hospitalized psychiatrically. I mean, it's, you know, this is really a period where you want to be as comfortable as possible. But, you know, we do find women that they delay care, or they do stop taking medications, or again, we do have those that have no idea what's happening. They know there's an onset of something, or family has realized that there's been some significant disturbance in thought and mood, and so all of a sudden they're coming, you know, to the hospital in crisis, and we encourage women to do that and keep doing that, because that's what we're here for. We're here to help them, but often we find that it's because they haven't had that link with care. And that's so significant. You know, and again, like we talked about before, sometimes it's, you know, women have noticed that these things have been going on, but they've been trying to cope with them the best they can and hoping that these things just sort of go away. And, you know, and sometimes symptoms do get better. We have coping skills that we can use, and sometimes, you know, depression or mood can wax and wane. But again, if more often than not you're struggling every day to function, it's just really important to get to your provider to talk about these things. And again, I can't emphasize enough, there are multiple methods of care. We have telemedicine that we're using now. There's so many ways to be linked with your provider. So it's really important that women, you know, understand that we validate these concerns as providers. There is no shame in this, and you are not, it again, like I think KK referenced, it's not your fault. So
yeah. I wanted to say, like, I have enjoyed the telehealth side effect of the pandemic. Obviously, that's not anything that we would have put together so quickly, but I think there are so many practices, so many therapists, and honestly, so many insurance companies who are now covering those remote access services that make it easier to get a therapist that's covered, that's taking your insurance, and it's been a huge help.
We've definitely seen a link with better obstetrical outcomes when women get treatment. So
I want to mention a couple of just scary things to look out for, especially when we're talking about untreated perinatal depression. So suicide, suicidality. So suicide is the leading cause of death in postpartum women. And although it's somewhat rare, I think it's about 1 in 100,000 in the US. Obviously that number isn't zero. So untreated postpartum depression can get to that point where suicide seems like the only option. And then infanticide, killing of the infant, is another thing, also pretty rare, but in those women who are experiencing psychosis and delusions and hearing voices that are telling them to do these things, sometimes they feel embarrassed or ashamed to share these things with their providers or loved ones. So I just wanted to put that out there, that's a thing that happens, and you certainly should seek care immediately if you're having thoughts about hurting yourself or your baby.
Yeah, one thing I wanted to add to that is that a symptom that I hear frequently mentioned in our support groups, and I'm always sure to mention it in childbirth classes, is intrusive thoughts. And that it's a little different from the hallucinations that you're talking about, in that you recognize that they're harmful and you don't want them. But that's something that a lot of women, when I mention it, they're like, oh, that's what that is. I thought I was just a horrible person, or I was crazy, rather than realizing that it's a recognized symptom. And for me, it was the first symptom to go away when I started getting treatment. So that's just one I wanted to mention. Like, a lot of people have these thoughts. Everyone has a morbid thought here and there. having them a lot is a sign of, need for help, and the treatment for it really does work. So
it does. I'll tag on to this, that these disorders are all highly treatable and responsive. So I have seen women come in at their worst, and we have started treatment, and I have seen them leave out much different people. So I just, these are treatable. I always highlight that. So
Absolutely.
I'd also like to add that with if a mom is depressed, sometimes she feels almost disassociated with her baby, and that can affect that child's development, other children's in the house's development, certainly her partner. So the depression doesn't just affect the mom, and that's one more reason we really need to get that mom into care, to be taken care of, because it affects the whole family.
Yeah.
Glad you brought that up, KK. It actually dovetails perfectly with my next question. I'd love for you to talk about how this can impact the non-birthing parent as well. Are they at risk for a mental illness, and kind of how does that come about?
We definitely don't talk about this a lot at all. And even more so now in the midst of this pandemic, it's certainly a thing that we should be on the lookout for. So birthing partners, especially those, same kind of risk factors for the mom with a history of depression or mental health issues in general, are certainly at higher risk for developing a postpartum depression, even though they're not the ones who are necessarily going through the pregnancy themselves. That risk is still there. And there have been some studies in fathers specifically about changes in testosterone levels towards the end of pregnancy and after delivery, and how those help with bonding with the baby, and that father-child relationship, and how sometimes if that's off, that can be a risk factor for postpartum depression. I think 8 to 10% of men, it's been studied mostly in fathers, can experience postpartum depression. So certainly a thing to think about, and be aware about. And I'll mention this too, while women who are postpartum experience that postpartum depression, the postpartum period specifically, usually symptoms are progressing and coming to a head, usually within 4 weeks after delivery, although it can certainly happen after that. For men, it's a little bit more insidious, and symptoms can kind of slowly increase and develop over sometimes a year. So it can be difficult to diagnose sometimes. So talking about that with their primary care provider, or even bringing it up to their OB if they go with their partner to their visits. Hey, you should think about postpartum depression. You should really talk to your doctor about that.
Yeah, I know my husband came home from a well baby visit with our pediatrician where he took the baby, and he was so excited that the pediatrician asked him how he was doing, and how are you sleeping, how are you coping, are you getting time alone to yourself to be able to healthfully cope with having 3 kids, and I think that we're going to be seeing that shift, especially because 8 to 10% of dads, that's a lot.
Mm-hmm.
Yeah. KK, did you have something to add to that as well?
No, I think I had read some statistic that it can be up to 10%. So it's real. And the American Pediatric Association has even recommended the woman or the father or the parent will probably be seeing a pediatrician more than any other provider in that first year postpartum. Yeah. So they're recommending they actually screen the person for depression. They can do the Edinburgh, we've got a couple screening tools, or they can just, like your provider did, just ask, how are you really doing? How are you sleeping? That type of thing.
Yeah.
And this is where that psychotherapy really comes into play, because you do have family therapy that you can do that includes the partner and the children as well. That would be kind of all encompassing everyone. So that's where it really becomes another example of where it's really important.
Mm-hmm. All right, so I've got a couple questions from our audience, and anyone can jump in on this one. It says, what should concerned loved ones be on the lookout for when it comes to perinatal depression? And then how can they provide support?
Some of the symptoms would be, I think we've addressed them a little bit, but anxiety for the mom, mood swings, anger, rage. That's not uncommon. And then either not sleeping, she's up all night, or she's sleeping too much. And they need to be gently addressed with the mom and with the provider. Maybe go with her to her postpartum appointment or to the well baby checkup and bring in a gentle, supportive way to the attention of the provider.
Yeah.
Another thing to look out for too. Oh, sorry.
Go ahead, Dr. Elie.
Look out for too is changes in day-to-day function. They're just not able to do what they usually do. Suddenly they're, not spending time with friends like they used to, canceling things, spending a lot of time at home. So that's kind of underlying all these symptoms too that are occurring.
Yeah, that one stands out a lot to me. Canceled plans was a big tell that I think a lot of people missed in my own experience. And for me, it was like an anxiety. I couldn't fathom packing the diaper bag and loading up the car, and that just was too overwhelming. So yeah, absolutely, it's a good one. Heather, what were you going to add?
Well, I was just going to say sometimes, you see complete withdrawal. So sometimes that happens, completely withdrawing from family. Again, it goes back to just overall function. But I think sometimes you see a real change in affect. So if there's kind of no affect at all, and you see that that your partner is really, like I said, withdrawing, then that's something significant to watch out for as well.
This next question touches on breastfeeding and medication. So Dr. Elie, can antidepressants pass through breast milk?
Oh, they can, and many of them have been studied, usually in animal models, some in infants, to see how much in the breast milk it's being passed. And there's a certain threshold below which the amount is negligible, and we don't think that may cause an issue. And then above that threshold, it may, but probably not. So a lot of these antidepressants, all of them do pass into the breast milk. So the baby is getting them, but usually, and even with the antipsychotics, the level is low enough to where it's not causing any issues that we need to be concerned about.
So go ahead.
There is a resource called LactMed, where you can look up any medicine and see how it affects, if it goes through the breast milk and what amounts. So there are resources out there.
Yeah, I was going to say, it sounds like a lot of it has to do with the dose that you're taking. Like you were saying, with very large amounts, they might get more. So if you're in a very high dose, and then also perhaps the size of the baby. So a very, very young baby, if you're on a very, very high dose, they might be more likely to be affected.
Right.
So that's something to discuss.
There are some medications that, especially some of the newer ones, that don't have a lot of studies out there as far as breastfeeding or being on them while they're pregnant. But they either fall in a class of medication that we are used to using, or the animal models that we do have show that the effects aren't great. So I would say for women who are on newer medications or on medications that have been known to have side effects in babies and are planning to get pregnant, that's something before getting pregnant to talk about with your primary care doctor, and maybe talk about switching to something different. And that's something that could be done even before the pregnancy happens. But there's so much literature out there, and it's really easy to look up on the end of the provider, as well as the mom and their partner as well, like lacked med, like KK mentioned.
Yeah. The last question we'll have time for is it normal to feel like I don't love my baby right away? I thought I would.
Yes, that's normal. It is normal. And sometimes a colicky baby, a fussy baby, or like we mentioned before, a baby that's in the NICU or has a lot of medical needs. It's a lot of moms go through that. They expect a rainbow, the unicorns, and real life, sometimes that doesn't happen. You form bonds. They're not just, they don't just get created. They take a while to form.
Yeah.
Mm-hmm. Yeah, I remember believing that from a lot of our marketing that we get about motherhood, that, oh, I believe in love at first sight because I'm a mom. I've seen that so many times. And yeah, that's not really how it works in the real world. Go ahead, Dr. Elie.
No, yeah, I agree with all of that, and there's such a spectrum of how moms respond to their children. Some moms are so in love with their babies even before they're born, they come and everything's great. And some people are like, who's this new human that I have to take care of and is not letting me sleep, and I have to feed them and my whole body is for them, so there's such a wide range of responses. And like I talked about before, if you're having those intrusive thoughts or thoughts about harming your child, of course, those are not normal, and should be discussed with your provider. But yeah, the lovey-dovey feelings and things may not come right away, and I think that's okay.
Yeah. Heather, did you have any thoughts on this one?
I think women just have to give themselves time. I agree with all of it. And again, I don't think it's one size fits all. So I think every birth is going to be different. Every circumstance is going to be different. Yes, I do agree that bonds aren't just, you have to form those. So, this is why I just think it's very important for mothers to be able to talk about these type of things, because I can venture to guess that in a support group, you would have other mothers that say, yeah, I haven't slept in, the last 8 hours. So yeah, I'm having difficulty really enjoying this right now. So it takes time, but again, there is a spectrum. So obviously, if you are having those intrusive thoughts, that's something you want to get to right away. But yes, I absolutely think it's very normal for mothers they need time to adjust. I mean, they have, you have to give them that, and we have to validate that. So
it's a strong thread through our whole discussion has been to just be able to talk about it.
Yeah.
Be open and able to share. Yeah. Does anyone have any final thoughts before we tuck it all in today?
No, thank you for doing this, Amy.
Yeah.
You're so welcome
for having us. Such a pleasure.
All right, so that brings us to the end of our time today. Thank you so much for your time and insight, Dr. Elie, KK, and Heather. And thank you to everyone who tuned in and for your questions on this important discussion. We will be sending out an email, and that will be for anyone who registered. You'll get a recording of the discussion today in case you missed it, along with some resources from the things that our experts mentioned. We do hope that you can join us for the remainder of the virtual series at the Baby Fair. Our next talk is tomorrow, Friday, April 30th. That's at 12 p.m. So grab your lunch, come join us. We'll be covering the topic of early signs of autism, and that'll be with pediatric neuropsychologist, Dr. Allison Moltisanti. To sign up and to see the full lineup, you can visit tmh.org/fair. So hope you have a great evening.
Bye.
Bye.